So you've removed gluten, maybe you've removed dairy, maybe you've tried more progressive elimination diets. You're eating clean, but your symptoms are still remaining. Could the missing piece actually be intestinal permeability, which is shown to be a factor in most cases of autoimmune disease like Hashimoto's, in most cases of irritable bowel syndrome, and a lot of chronic health conditions? Hi, welcome to today's episode of Thyroid Pharmacist Healing Conversations with Dr. Izabella Wentz, your thyroid pharmacist. That's me. Today, we're going to be diving into some of the root causes of intestinal permeability, also commonly called leaky gut. But if you were to do a search online for leaky gut, people might say it doesn't exist. And when you actually search for intestinal permeability, you will see thousands of published medical research supporting the fact that intestinal permeability does exist and it does play a role in autoimmune disease, IBS, Hashimoto's, and a whole host of other chronic health conditions. There's a connection between the gut and the thyroid and the immune system. This connection was, I believe, made popular by a researcher named Dr. Alessio Fasano. And he talked about the three-legged stool of autoimmunity, where we need to have a genetic predisposition for a health condition. We need to have some kind of a trigger, so something that brings on the condition. And then for the third factor that needs to be present in order for autoimmunity to develop is known as intestinal permeability or leaky gut. Now, here's the thing. It can be quite challenging to figure out what your triggers are, right? So is your trigger excess iodine? Is your trigger a deficiency? Is your trigger an infection? So on and so forth, right? We don't always know what our triggers are. The other part of the three-legged stool is genetic predisposition. In this day and age, we can't really change or choose our genes. Like we're kind of gonna get what we're gonna get. But the third factor, the intestinal permeability factor, we can always work on that. And we can find some really relevant root causes that, when treated, you can actually get this three-legged stool to fall by treating the leg of intestinal permeability, and then the autoimmune condition stops expressing itself. So, what does that mean for a person with Hashimoto's or irritable bowel syndrome or other conditions? Is your symptoms start improving. The inflammation improves in your body. And then, if you have markers of autoimmunity, such as thyroid peroxidase antibodies or thyroglobulin antibodies, those will start reducing themselves and eventually get into a remission range. So, today I want to talk to you about some common drivers of intestinal permeability that I have seen in people with Hashimoto's, and also, spoiler alert, irritable bowel syndrome. Um, I have to share with you that before I got diagnosed with Hashimoto's, I had an irritable bowel syndrome diagnosis. Not the most glamorous diagnosis to have. Definitely not fun. And I treated that pretty much with over the counter medications. I found that eating less red meat seemed to help, but I never really got like a really good handle on it. And then eventually I started to have more and more progressive symptoms. Now, by the time I was in my late 20s, I was diagnosed with Hashimoto's thyroiditis. And I started to try to figure out if there was anything I can do to make myself feel better, if there was anything that brought on the condition, and if I can get the condition into remission. This is when I came across Dr. Alessio Fasano's work. This is when I came across the Institute of Functional Medicine and functional medicine training. And I learned that in many cases, a person will have a diagnosis such as irritable bowel syndrome or symptoms of irritable bowel syndrome for 5, 10, or 15 years before they get an autoimmune diagnosis. And the timeline really fit with me. I was in my early 20s when I started to have irritable bowel syndrome symptoms. And then as time went on, I started to have more and more symptoms to the point that I was diagnosed with Hashimoto's. And what scientists and researchers believe is that there is this intestinal permeability component that essentially prevents the immune system from working properly. And so instead of your immune system being managed properly, a lot of that immune system is in the gut. You go on to attack benign things such as foods, and you can go on to attack your own physiology. In my case, my immune system decided that my thyroid gland was a threat. And so it marked my thyroid gland for destruction. And this is what happens in people who have Hashimoto's, most common cause of hypothyroidism in the developed world. So, what does it mean to have intestinal permeability and what are the symptoms? Well, for about 50% of people, it's actually an asymptomatic condition. So, they may not have any symptoms of it, but they might have autoimmune markers that suggest this is an issue for them. They might have markers such as elevations in zonulin. If they were to do a test for this is something that you can order through functional medicine practitioners. I'll also put a link to Rupo where you can self order that and give you more information on how to get access to that type of testing. There's also a test known as lactulose mannitol test that can also test to see if you have intestinal permeability or leaky gut. So, some people may attribute symptoms like autoimmunity or inflammation or joint pain to intestinal permeability. And this is oftentimes the case where people will present with various symptoms, and you can probably connect a whole host of symptoms to intestinal permeability just because we know that autoimmune conditions have hundreds of symptoms. The most classical symptoms, however, of intestinal permeability are going to be digestive symptoms. So, irritable bowel syndrome that might present like diarrhea, constipation, bloating, stomach pain, sometimes acid reflux. And a lot of times, people with intestinal permeability are going to be diagnosed with irritable bowel syndrome, but in many cases, they're not. So they might just be having some quote unquote occasional digestive symptoms, and sometimes they might have zero digestive symptoms. So just because you don't have not necessarily digestive symptoms doesn't mean you have intestinal permeability. However, if you have an autoimmune condition like Hashimoto's, there's a good chance that you do have intestinal permeability. If you have IBS, there's a very, very good chance that you have intestinal permeability as well. So the gut is oftentimes a super, super important target for you to treat. When I first started to learn about intestinal permeability, I learned about the role of foods in triggering inflammation and triggering that leaky gut in our bodies. And this makes sense, right? Because what we're eating is going to really impact our digestive function. One of the first studies I came across on my healing journey with Hashimoto's was in people who had celiac disease and Hashimoto's. Their celiac disease were newly diagnosed. And once they got off of gluten, a lot of them were able to improve their thyroid function. Some of them, actually just being gluten free, were able to shed their Hashimoto's diagnosis. And so I wondered to myself, oh, could I have a condition like celiac disease that's causing my Hashimoto's? And of course, my doctor at the time was like, oh, you don't have celiac disease. Gluten is not something you need to worry about. But looking at different patient experiences and working with integrative practitioners, going through functional medicine training, I decided to give the gluten free diet a try. And lo and behold, I felt significantly better just a few days. A lot of my symptoms, like acid reflux and IBS symptoms and pain, uh, fatigue started improving. A lot of things got really better when I went gluten free. And I was like, okay, so maybe it was the gluten causing my intestinal permeability. And then I got into deeper about different foods. So there's other food sensitivities that can actually cause intestinal permeability, gluten and dairy being the most common ones, but also soy. And in some people, it could be a whole host of different food sensitivities, typically managed by the IgG branch of the immune system. And what I've noticed initially with my own health and studying people with Hashimoto's and going to functional medicine trainings is that there tended to be a cluster of foods that were more likely to be problematic. In addition to gluten, dairy, and soy, also eggs, nuts, grains, and nightshades. For a while, Elimination diets were I found to be very, very helpful for a lot of people with Hashimoto's. And there were also dietary protocols like paleo and autoimmune paleo that I have found to be very helpful for many of my clients. However, I will say in some cases, people would get stuck. So they would eliminate a whole bunch of foods, they'd start to feel better, but then they'd reach a plateau and some of their symptoms would start creeping back, right? And this actually happened to me. I had been on the GAPS diet, which is an elimination diet. And all of a sudden, I stopped making progress where my symptoms just were not getting better. And actually, some of the bloating started to come back. And I did another food sensitivity test, and it turned out that I was sensitive to more foods. Now, food sensitivity tests out there on the market, there's a lot of them. Some of them are completely disconnected from what's actually happening in the body. Some of them do have a long track record of showing the correct results. So if a test says that you are pineapple sensitive, by golly, if we take pineapple out of your diet, you're going to feel better. This is very relevant too. If you're thinking about doing a food sensitivity test, I only recommend all tests. In my experience of over 10 years, this has been the one that's been reliable. If you've done other food sensitivity tests, there's a chance that you might have false negatives and false positives. But I digress. So I was talking about how in some cases you can eliminate all the foods and feel better. In some cases, you can eliminate just a few foods and feel better. If 90 days goes by and you've eliminated foods and you're still not 100% better, there's something deeper going on underneath the surface. So it could be a nutrient deficiency. For example, glutamine and zinc are the two most common nutrients that can be depleted in people with digestive issues and digestive distress and autoimmune disease. They are critical for gut lining repair. There are various things that can really set them off and deplete them. So if you're under a lot of stress, if you have low stomach acid, if you have low protein intake, there's a really good chance that you might be deficient in these nutrients. In my experience, people who are runners tend to deplete themselves of glutamine. People who are chronically sick with colds and things of that nature and viruses, they might be zinc deficient. People who are have a poor appetite are oftentimes going to be zinc deficient. Some people are genetically predisposed to have less zinc absorption from their foods. So these are some additional considerations to have. Generally speaking, you can support gut health and intestinal permeability with supplementing with zinc and L-glutamine. L-glutamine might be up to 5 grams a day, sometimes up to 15. You definitely want to start low and go slow. It can make you quite constipated if you've had diarrhea. And zinc, I usually like to recommend the zinc picolinate version or zinc carnosine version. And with regard to the picolinate, you don't want to go above 30 milligrams per day or any kind of elemental zinc unless you're working with a practitioner, because that can deplete some other nutrients as well. So these are two potential reasons why you might still have intestinal permeability and or leaky gut even if you've eliminated some foods. The other potential root cause might be small intestinal bacterial overgrowth. So, our small intestine is supposed to be sterile and not have any kind of bacteria growing in it. And when we have an overgrowth of bacteria there, sometimes this happens from food poisoning. Sometimes it happens because our digestion is slow, or we have low stomach acid, or we might have H. pylori. This can actually contribute to intestinal permeability. In fact, Dr. Alessio Fasano mentioned that SIBO, or small intestinal bacterial overgrowth, makes the gut more permeable, and if for many people, than gluten does. With gluten, you can have a variety of reactions anywhere from months after one exposure to gluten, where you have intestinal permeability for a long time, if you have celiac disease, or minutes for other people that might not be sensitive. With SIBO, it's going to be an ongoing thing. Like as long as those bacteria are on in your small intestine, they're going to be causing intestinal permeability. We can test for these with a breath test. It's relevant to note that people with hypothyroidism tend to be more susceptible to SIBO. One study mentioned, very tiny, tiny study, about 50% of people with hypothyroidism actually had SIBO. So this is something that is very relevant for a lot of people with Hashimoto's. Some of the symptoms to watch out for would be bloating, reflux, reactions to high fiber foods, reactions to probiotics and fermented foods. SIBO bacteria can be very powerful histamine producers. And so, this is something that you might need to treat with herbals, medications, such as rifaximin, and even a targeted elemental diet. Again, I do recommend breath testing to figure out if this is a root cause for you. And for many people, this has actually been tied to irritable bowel syndrome. And about 70% of the time, people with irritable bowel syndrome will have this as a potential contributing factor. Now, beyond that, you can also have an overgrowth of various other microbes in your body. One of them could be candida, one of them could be mold. I oftentimes will recommend testing with an organic acid test and a mycotoxins test to see if that colonization is relevant for you. Typically, I see this with people who have urinary issues, oxalate issues. They might have weird kind of food cravings, especially for sugar. They might be sensitive to carbs. They might have blood sugar issues, mood changes. These are some things that can be very much relevant to an autoimmune journey. Again, these things do need to be treated accordingly. A lot of times I might recommend antifungal meds or antifungal herbals. And then another very underappreciated root cause is actually parasites, which can be powerful drivers for intestinal permeability. In Hashimoto's, about 30% of people have the protozoal parasite Blastocystis hominis, in my experience. And this parasite can actually make people shift their immune system to be more of like attack my thyroid variety. And in my experience, people oftentimes do go into remission when that protozoa is treated. The research is now showing they've done case studies and very small clinical trials of patients that do go into remission with Hashimoto's when they have this parasite and a parasite is properly treated. Oftentimes, I recommend something like a gut GI map or gut zoomer test to figure out if you have this, if this is relevant for you. There's also a test called Para Wellness Research test that looks for different types of protozoa. Some people have this, some people have others. And I also really love to utilize the beneficial yeast Saccharomyces boulardii to clear that protozoa. Some people might do like parasite cleanses that are very popular, that are on the market, but it's important to note that not every parasite is susceptible to every cleanse, to every herb, and to every medication. So for this particular one, the medication Alinea tends to work best. There are other medications that have been used historically that have led to resistance, such as metronidazole, for example, might not work so well for this particular protozoa. The other really interesting thing about this protozoa is that it also has been found to cause chronic hives, chronic urticaria, and irritable bowel syndrome. So, even in greater percentages than what I'm finding in Hashimoto's, um, Hashimoto's was about 30%, but more people with chronic hives and more people with irritable bowel syndrome are actually being found to have protozoa such as Blastocystis hominis, sometimes Giardia, sometimes others that are in their system, and nobody's really detecting them, nobody's really finding them. Sometimes the protozoa make them sensitive to a whole bunch of foods. Sometimes the protozoa predispose them to have SIBO. And really prevent them from properly managing their gut integrity, leading to that intestinal permeability and leading to the expression of IBS symptoms, as well as to the expression of autoimmunity. So, I've kind of done a really big deep dive on gut health because a lot of the information on the market was if you have leaky gut, then you need to have eliminate some foods, maybe have some bone broth, have a few probiotics, and then you'll heal your gut. And clinically, like there were some people with Hashimoto's that got better this way, but then other people with Hashimoto's did all those things and they still weren't better. And so I really had to do a deep dive into figuring out what was driving that intestinal permeability with people. And through that process, I've worked with a lot of clients who had both Hashimoto's and irritable bowel syndrome, and a lot of the factors do overlap. One of the things I'm super excited to share with you is I've been working on this book about the root causes of irritable bowel syndrome. This is coming out on March 17th, but it could be pre-ordered on Amazon and Barnes and Noble and wherever fine books are sold right now. And this book really gets into finding and treating the root cause of irritable bowel syndrome. And I will say, like, I've gone down the rabbit hole. So if there is a cause or a driver of your gut issues, of your autoimmune issues, it's going to be in there. A lot of times we say that disease begins in the gut. I truly do believe that. I think for a lot of people who are chronically ill, they have Hashimoto's, fibromyalgia, irritable bowel syndrome. There are just so many connections to the intestinal permeability. And I've created this book for you guys so that you can take charge of your own health and that you can figure out what's really behind all of your gut challenges. I hope that you'll check it out. Again, it is available now for pre order. This is kind of my official first announcement for letting you know that it's out in the world. I have to say, it took about 12 years to write. It is something that has the knowledge base has been really growing for me. I felt a little bit of imposter syndrome when I was writing it because I'm like, hey, I'm a thyroid specialist. This is where I've been focusing up my energy. But again, I've had so many people with irritable bowel syndrome that I had to help to get their thyroid balanced and get their autoimmunity balanced was really a big focus on their gut health. And then about 7 years ago, my husband was actually diagnosed with inflammatory bowel disease and ulcerative colitis. And so we had to figure out how to get that into remission. And that really streamlined my understanding of gut health. I have helped thousands of people at this point recover their gut health and recover their health. So getting IBS into remission, Hashimoto's into remission, even inflammatory bowel disease into remission. A lot of times other things shift and symptoms improve when you heal your gut. I saw a meme many moons ago. It was like, I have 99 problems, but healing my gut solved like 97 of them. And I think that is very, very relevant to what I've been seeing in my own health, in my family's health, and in the health of the clients that I've worked with. Like migraines go away, asthma symptoms go away, allergies go away. Um, all kinds of things that every now and then I'll still be surprised at the symptoms that do go away when a person has intestinal permeability and we figure out what's driving it and then we treat it properly. So, super excited to share this with you. If you know somebody that might be helped by a root cause approach to irritable bowel syndrome, please share this information with them. If you know somebody who's dealing with autoimmunity and intestinal permeability or Hashimoto's, please do share with them. I hope this conversation has been healing on your healing journey. Until next time.